go back quickly to our earlier story on the three-day warning strike that's been embarked upon by resident doctors in the Federal Capital Territory. To discuss that, we're joined by Dr. Francis Okpalaobi, Vice President of the Association of Resident Doctors, FCTA. He joins me now from Abuja. Thank you for giving us your time. Quickly, let's clarify. The strike is by the Association of Resident Doctors in the employ of the FCT administration and not nationwide, right?
Yes, thank you very much, viewers. Yes, the strike is embarked upon by the Association of Resident Doctors, FCTA, that is Federal Capital Territory Administration. That comprises all the doctors that are under the employ of the FCT, all the general hospitals, and there are 14 general hospitals.
Okay, I just needed to clarify that before I go ahead and ask what the update is. You gave the federal government, the FCT authorities, 21 days to react to your demands. Has there been any kind of interaction in the 21 days that you gave?
Yes, thank you. We have, during this period of 21 days, we have had a series of engagements with the different officials of the our management, from the Director General, even up to the head of service, the Monday Secretary. So we've held a series of meetings, concerning our demands, which was the reason why we embarked on this 3 days warning strike. But up till now, it is only one of our demands that I can categorically say that they have started attending to. So that is the reason for the strike. So most of our demands, which are actually 9 in number, have not actually received, the attention it demands for the doctors that cater for lives in the Federal Capital Territory.
So which of these demands, you said they are only working on one. Which of them are they working on? Is it the salaries, the 5-month salaries?
Okay, right now, the issue of the 6 months, even up to 6 months salary arrears owed to a good number of our members have not actually been attended to as we speak. Yes, there have been promises from the management concerning this, but we've not seen meaningful progress being made, because most of these are our members, they have suffered, they worked for 6 months without being paid their salaries. That is disheartening. Somebody in these economic times to work for 6 months without being paid. But the one that has been attended to is the medical residency training fund, which some members have started getting, but not everyone.
Okay, we're time constrained, so I'll just go ahead and ask this last one. Strike seems to be the only language, unfortunately, that the government listens to when it comes to issues like this. But sometimes the listening doesn't always translate to productive response. What would be your next steps if they don't respond positively to your demands in the next 3 days? Would you, call up the warning strike for a dialogue if they ask you, or you want more concrete action?
Okay, so right now, we are guided by our Congress. So after the warning strike, because warning strike should be able to give them our management time to be able to make a reappraisal and try to work on these demands. If that is not done, we'll get back to our Congress, because we usually have emergency Congress meetings at times like this. So when we have our meetings, the Congress should be able to give us a position on if we're going to either give them more time to try to attend to these demands, or we're going to resort to, a timeless shutdown.
Dr. Okpalaobi, thank you for speaking with us, and we do hope that the government will do the needful for you. Thank you.